Hello everyone, I am Dr. Vicky Bakshi, MD in Pulmonary Medicine, and today we will be talking about a guidance for certifying TB patients as non-infective issued by Ministry of Health and Family Welfare India on 30th of May this year. So why this guidance matter? So this guidance actually matters because we have to determine whether patient of tuberculosis is no longer infectious, especially if the patient has to go return to work or has to go back to school. So we must remember the main four governing principles over here, which we'll be talking about in each of the slides, which will be coming now. That is adequate duration of regular treatment, verified drug adherence, consecutive negative AFB smears, and clinical improvement or no radiological worsening. So first coming to the drug-sensitive tuberculosis and H. monopolyresistant tuberculosis. So among this, the first subsection is non-extensive non-cavitatory pulmonary tuberculosis. So it may be declared non-infective on basis of duration, adherence, AFB smears that come out to be negative, and clinical course. Among duration, at least 2 to 3 weeks of regular treatment as per standard care of regimen under NTEP guidelines. The patient should be compliant or adherent to the drug consumption. The consecutive two AFB smear negative sputum samples should be there, which should be at least 7 days apart. Among clinical course, there should be evidence of clinical improvement with no radiological deterioration. Coming to bilateral extensive cavitary pulmonary tuberculosis, here the duration goes from 2 to 3 weeks to 4 to 5 weeks. Adherence should be there. Two consecutive AB smears negative samples should be collected. That should be 7 days apart. And there should be evidence of clinical improvement with no radiological deterioration. When we compare the non-extensive, non-cavitatory with the bilateral extensive and cavitatory disease, here we can see that the minimum treatment duration is 2 to 3 weeks for non-extensive, non-cavitatory, while 4 to 5 weeks for bilateral, extensive and cavitatory disease. Other than that, there is no difference between the two diseases. Now coming to drug-resistant tuberculosis. So first coming to DRTB with BPaLM regimen or patient who are on shorter oral regimen. Here the duration of treatment should be for 9 weeks. The patient should be adherent during the duration of the treatment. And here there should be 3 consecutive AB smear negative sputum samples collected 7 days apart. And there should be evidence of clinical improvement with no radiological deterioration. If we go to DRTB with all oral longer regimen, here the duration increases to 3 months of regular treatment. Adherence should be there. AFB smears, 3 consecutive AFB smear negative sputum samples collected 7 days apart, and evidence of clinical improvement with no radiological deterioration. When we are comparing the DRTB regimens, we can see in BPaLM and shorter oral regimen, the minimum treatment duration is 9 weeks, while in all oral longer regimen, the treatment duration is 3 months. Other than that, there are no differences. When we compare DRTB regimen to the DSTB regimen, we can see that the AFB smear requirement is different. In DSTB regimen, you can remember that we have to have 2 consecutive negative AFB samples that should be 7 days apart. Whereas in DRTB, there should be 3 consecutive negative AFB samples that should be 7 days apart. Now, one thing we should remember that if any sample that comes out to be positive, we have to again repeat the consecutive negative samples to certify the patient as non-infective. Coming to extrapulmonary TB cases, whether drug sensitive or drug resistant, extrapulmonary TB with concurrent pulmonary TB, it would be dealt as a case of pulmonary tuberculosis, and extrapulmonary TB with no evidence of pulmonary tuberculosis, then the decision rests with the specialist that is treating the case. For example, in case of cervical tubercle lymphadenitis, an ENT surgeon would be in a good position to declare the patient to be infective or non-infective. Now coming to the minimum duration and AAB requirements for drug-sensitive TB monopolyresistant non-extensive non-cavitatory disease, minimum duration is 2 to 3 weeks. 2 consecutive AFB negative samples should be there 7 days apart. Similarly, in drug-sensitive TB monopolyresistant bilateral extensive cavitatory disease, Minimum duration increases to 4 to 5 weeks, and the AFB negative sample should be two consecutive 7 days apart. In drug-resistant tuberculosis, BPaLM regimen or short overall regimen taking patients, the minimum duration should be 9 weeks, and there should be three consecutive AFB negative samples that should be 7 days apart. While patients on all oral longer regimen, the minimum duration will be 3 months, and the three consecutive AFB negative samples are required that should be 7 days apart. In extrapulmonary TB cases with pulmonary involvement, the duration and the AFB negative samples would be as per the pulmonary criteria. In extrapulmonary TB without pulmonary involvement, it all depends on the respective specialist's decision. So what stays constant across every category is that the physician's clinical opinion is very important, and we should verify the daily adherence of the compliance of the patient on the drug regimen. The sampling interval should be at least 7 days apart, and there should be clinical improvement with no radiological deterioration. So here, radiological improvement has not been taken as such because we all know that radiological improvement lags behind by around 4 to 6 weeks after clinical improvement. So patient counseling is very important, and long-term follow-up is equally important. Cough etiquettes should be discussed with the patient. There should be timely follow-up during the treatment as well as after the treatment, and the patient should be encouraged to consume nutritious food in addition to the prescribed antitubercular treatment. So these are the key takeaways for certifying non-infectivity. So the duration scales with the disease burden, that is 2 to 3 weeks from drug-sensitive tuberculosis up to 3 months for all oral longer regimen in drug-resistant tuberculosis. DSTB requires two consecutive AB negative samples, while DRTB requires three, and they should be always 7 days apart. A single positive sample resets the clock. That is, we have to repeat the full negative sequence before certifying the patient as non-infective. Clinical improvement and stable or improving radiology must both be present, not either alone. Extrapulmonary TB without pulmonary disease is certified at the treating specialist's discretion. Counseling, nutrition, and 6 monthly follow-up for at least 2 years post-treatment remain essential to this guideline. Thank you so much for listening. Like and subscribe this channel for more such information. Thank you.